Welcome to Tools on Tuesday, everyone. Thanks for joining us here today. I'm your host, Jacqueline from Telespark Science Center here on Treaty 7, Alberta. Before we begin, I would like to ground us to the land. The Calgary Science Center, operating as Telespark, is a registered educational charity in Calgary, Canada. Spark thrives on the ancestral lands of the Niitsitapi Blackfoot Confederacy and is grateful to the long-standing caretakers of the land, who along the Tsuut'ina, the Ayahi Nakota, and the Government of Canada signed Treaty 7 in 1877. It acknowledges that Treaty 7 sets out an agreement for reciprocal peace and friendship between self-determined peoples. The city of Calgary is also home to Métis Nation Region 3. As a first-generation Canadian in my family, I have much gratitude for this land. Thank you so much for joining me from wherever you are across the globe and Canada. Do you ever just look at your pet and wonder what on earth is going on in that head of theirs? Joining me today is a very special guest, Dr. Kathryn Winger, who is a veterinarian neurologist and assistant professor of neurology at the Michigan State University College of Veterinary Medicine. She specializes in analyzing the brains of some of your favorite animals. And today we are looking at our tool of the week, the MRI, or magnetic resonance imaging. Please give a warm digital welcome to our special guest, Dr. Kathryn Winger. Hello!
Hi, Jacqueline. Thank you so much for having me here this afternoon. I'm really excited to talk about animals.
I'm so excited, and I know our visitors are excited as well. We are diving deep into all the deep corners of brains and animals' behaviors and cognitive function. So I have to ask you, as a neurologist, veterinary neurologist, how do you work with the MRI on your day-to-day basis?
Yeah, so my job is to evaluate animals that may have problems with their nervous system. And so that includes their brain and their spinal cord, as well as the nerves that go from both of those areas out to the rest of the body. And when we see a patient showing neurological symptoms, just like on the human side of things, it can be for a number of different reasons. And since the nervous system is pretty well contained, they're hidden inside the bones, like the skull and the spine, we need to use some advanced imaging techniques to really get a good look at the structure and see if there's a problem that we can then hopefully treat.
This is really fascinating to me because the MRI is actually a fairly recent invention. I don't think we did the first human scan until the late 70s. So I'm curious, what types of animals have you worked on with the MRI?
Yeah, that's very true. In terms of imaging, it is kind of one of our more recent developments, especially when you think about something like an X-ray that's been around since the 1800s. So as far as MRI, you're right. The first human animal or MRI that was done was in about 1977. There was actually an animal MRI done prior to that. That was on kind of laboratory rats in the early 70s. But even still, MRI wasn't really widely available to us to practice clinical medicine, probably until like the last 15 to 20 years or so. It's definitely becoming a lot more available, but it's still kind of a challenge just because of the kind of difficulty to find MRI availability in various areas and also the cost associated with it. So when we do MRI, there's kind of two different groups that work here. One is for research purposes. So they have their own area. And then I work at the Veterinary Medical Center, which is where we mostly work with pets as well as working animals. So most of my job is working with dogs and cats, but occasionally we do see some more exotic animal species as well.
Like the kangaroo?
Yes.
I'm very excited. I'm looking forward to tapping into these brain scans, and we actually have some here that you've provided to us. So let me just pull up these images here. All right. So, here are your cats. You've got 3 rescue cats?
I do, yes. I am not ashamed to admit that I am a crazy cat lady, and I love working with cats.
Nothing to be ashamed of. So this is the MRI system itself, and you're right, it's expensive, it's not readily available, but you can use this to examine brain or house cat brains. So here's an image that you've provided to us of a domestic cat, and this image looks eerily similar to our brains. So what can you tell us about the similarities and differences between this and a human brain?
Yeah, that's a great question. So really all mammals have the same basic structure. When we look at the brain, it's subdivided into several different areas that all serve different purposes. And they can be developed in different ways depending on what that animal or person is expected to do on a day-to-day basis. So for example, the cerebral cortex, which is the big front part of the brain, is really well developed in people. And that's because we do a lot of critical thinking and we speak and we read. And other species are going to have different tasks. And even across the same species, we can see some differences just based on how they're bred and their genetics. So the basic structures are always going to be very similar across the board, but we can see some changes just depending on the patient's size as well as their species.
So it really depends on the evolution and adaptation of how these species use their brain. That's going to determine what it looks like and how similar it is to humans.
Exactly. Yeah. So it really depends on kind of how much higher cognitive processing we do versus how important are things like voluntary movement, being able to run, being able to hunt. All of those things play a role in how the different brains developed.
So this image here, this is just a slice of a domestic cat, but it's not an MRI brain scan. Is that correct?
Correct. So this is an image of a cat brain that was obtained with a microscope and special stains just to highlight different parts of the brain. So you may hear the terms gray matter and white matter, which refers to the cell bodies themselves versus the tracks that connect the different parts of the brain together. So on here, most of the gray matter is actually the more kind of yellow light gray, and then the white matter is the darker gray.
Gotcha. But you actually have an image of an MRI scan of a domestic cat.
Yeah,
Let's
I
pull that
do.
up and show our audience what that looks like.
Yeah, so here I have a few pictures of a cat, and what I want to sort of show you is the areas that, again, are very similar across different species and some of the things that are different. So earlier we mentioned the cerebral hemispheres, and that's this part of the brain here. So again, that's where all of our kind of sensory information is processed, where we do all of our thinking, where we interpret things that we can see and things that we can hear. So the size of that structure can vary, as well as what we call the gyri and the sulci. And so those are sort of these grooves or hills kind of in valleys. And the more that we have, that means the more cell bodies there are. And usually that means the more interconnections we'll have across different areas. One
Whoa.
thing that's really interesting comparing a cat to a person is this structure here, and that's called the olfactory bulb. So that's actually where the brain connects to the nose and helps us smell. So for people, although we do have one, it's really, really tiny compared to a cat or a dog or another animal species that's going to be going out and needing to find things to eat.
That makes sense. Their scents are much more dominant than ours.
Yeah.
They use it to tell time, I heard even.
Potentially, yeah. So they definitely have a lot of things going on that can help them, be good predators. And then another part of the brain that's really useful is this area back here. And we call this the cerebellum or little brain. And its job is going to be to help set what we call the postural platform. So regulating kind of your muscle tone, as well as coordinating all of your movements. So that's another area where development kind of changes quite substantially depending on, is this a type of animal that needs to get up and run away as soon as it's born? Or is this something that's going to develop more slowly as they age, such as with people, where it takes us a long time before our brain really reaches maturation?
Gotcha. One thing for our guests at home too, if you have any questions for Dr. Kathryn Winger, make sure you pop it in the comments down below. We'll be sure to feed it to her too. So keep your questions coming.
Yeah, so one of the great things about MRI, especially when you compare it to some of the other imaging modalities that we have available, like an X-ray or a CT scan, is that the MRI is really good for looking at soft tissue. So like I mentioned, the brain especially is encased in bone. And so I do have kind of the skull of a dog here,
Oh
which just
yeah,
kind
let
of
me see
shows
that.
you, yeah, all of the bone involved. And there's a little window in the side here, and this is going to be the space where we actually will have the brain within it. And so with other imaging techniques like an X-ray, those are going to be really good at looking at the bone. But
Mhm.
unfortunately, that bone then prevents us from looking at the soft tissues inside. So with an MRI, we have much better contrast. And
Mhm.
what it is really designed to do is tell the difference between different tissues. So on these images, for example, the brain is kind of this one shade of gray, and then the fluid that surrounds the brain is really bright white. And then when we have diseases, that'll also affect how bright or dark these tissues are. And that can help us, again, determine if there's a problem and what that problem might be.
So you're showing us the cerebral cortex, you're showing us the olfactory tube, and the section of the brain for coordination. We've got a question here from Colleen, and she would like to know, can older cats get dementia? Where in the brain would the MRI show that?
Yeah, so unfortunately, dogs and cats, and probably other species too, can get what we call cognitive dysfunction as they age. And so that's mostly going to be associated with the cerebral cortex. So they basically get atrophy or lose cells throughout the brain in the areas that are, again, responsible for processing their stimuli from the environment and kind of contributing to personality and behavior.
Very cool. Thanks so much for the questions. So this is a domestic cat MRI, and
Yes.
you know what? You've pinpointed a lot of similarities between humans and kangaroos. I'm so curious about the kangaroos. Can we see the kangaroo brain scan and what
Yes.
that looks like and how it compares to the cat and humans?
Absolutely. So this next MRI is a kangaroo. Where is it? There we go. And so you can see that at first glance, it looks quite a bit different. But again, the main structures are all the same. And the one thing that really struck me when we did this MRI, again, was the cerebellum. So that's this back part of the brain that helps with coordination. And when
Mhm.
I look at the cerebellum of this kangaroo compared to the cat, it looks like it's a lot bigger, especially in the area that's really important for kind of our coarse muscle movements and setting posture. So
Mhm.
what I suspect in this case is that since kangaroos are bigger animals and they have a lot of muscle mass, especially going down through their tail, they need an extra amount of tissue in this area in order to be able to coordinate all of those big structures. In contrast, they don't have quite as much of a cerebral cortex and not quite as many of those folds that we talked about, the gyri. So it's not to say that they're not smart, but certainly there will be fewer interconnections across other brain areas, which is why they don't have the same ability to kind of process some of the things that a cat can do. Cats are going to have much better developed areas in the brain that help with really fine motor control. So if you've ever watched a cat, they're really good at moving their toes and kind of grabbing things. And so that's a skill that's unique to them and other species like people that really need that dexterity, again, to really go about their day-to-day life in the best way possible. Whereas with a kangaroo, really one of its most important things is going to be moving around at a pretty high speed.
This is so fascinating to me. I've honestly, I've never even seen a kangaroo in real life before. So seeing the brain scan and understanding how it works, I kind of start to build this empathy towards animals as well, of course. So this is all really fascinating. We are comparing the kangaroo to the cat, but you've also administered MRIs to dogs and horses.
Yeah.
So I was hoping we could show the audience the dog scan. And Joyce also has a question here. Joyce is asking, is there a dog equivalent to ADHD?
Wow, that is an excellent question. And I don't know that I would compare it to ADHD specifically, but absolutely dogs, just like people, can get a lot of behavioral disorders. And some of them can be really anxiety-based disorders. They can get obsessive compulsive type disorders. And unfortunately, they're a lot harder for us to diagnose because we can't ask them how they're feeling. We have to infer a lot from their environment and, most importantly, from their owners. Their owners are going to be the most adept at telling us if they're experiencing abnormal behaviors. And so you can actually be a veterinarian that specializes in behavior and really explore all of those different diseases. And there are a lot of different treatments. A lot of the things that are used in people, like Prozac and Xanax, actually can be used in dogs and cats as well for different types of conditions.
Very cool. There you go, Joyce. Thanks for your question. All right, so we're looking at a brain MRI of a dog, a domestic dog.
Yeah, so the dog is pretty similar to the cat as far as the way that it's developed. So they have really similar structures. And so again, the nice thing about looking at an MRI and about anatomy is that the brain has two halves. So you may have heard people say, you can be more left-brained or right-brained. That's one of the nice things when we're looking at an MRI is to try to decide, is there a difference from one side to the other? So this is a dog that overall was pretty normal, but you can actually see there is some change from one side to the other. So a little bit more fluid on one side than the other. And this is just a malformation or a change that's benign that the dog was born with, but is something that just kind of highlights the amount of detail and the subtle things that we're looking for when we have a patient that presents with a different disease process. What I find really fascinating comparing some of these MRIs as well as kind of the relative patient size is not only how the brains themselves look different, but also how the brain sizes are different. So when we think about the size of a cat that's maybe about 3.5 kilograms or 7 pounds or so, that cat's brain is going to be about 30 grams, so about 10% or 1%, sorry, of its body weight. For humans, we're looking at about 2% of our body weight is our brain. And then something like the kangaroo is going to be even smaller. So the kangaroo brain, even though a kangaroo is about 10 times the size of the cat, its brain is only twice as big.
But that doesn't mean that it doesn't equate to their intellectual capabilities or anything like that. The brain size doesn't matter. Is that correct?
To an extent, yeah. So the brain, again, develops for different reasons in different animals. And because there's quite a big energy expenditure, there's this trade-off between the size of the brain and thus the needs that it has as far as, sugar and blood supply and oxygen. And so if your brain is very large, like humans, we do have kind of the largest brain size relative to our body weight. Absolutely, we have higher cognitive abilities in some areas, but that does come with some disadvantages. So we're not going to be nearly as good at certain athletic activities or other things when compared to other species.
Very cool. So you also have a scan of a horse as well. I'm curious to see the similarities between the dog and the horse too. So I'm noticing a lot of these are very similar to our brains, which is very promising.
Yeah.
And let's see the horse one here.
So what I think is really exciting about the horse, again, is that when we look at the structures, the horse has actually developed in a slightly different way than some other animals. And so although the horse brain is pretty small, again, relative to its body weight, so a normal horse is going to be about, at least 1,000 pounds. The brain itself is only about 2.5 pounds. So the size of their brain is actually smaller than that of the average human. But in order to still have good function, they have quite a lot more of these folds, or again, these gyri and these sulci, so they can still have a large number of cell bodies in a smaller amount of space. And again, that's to try to conserve energy and still give them the ability to be as powerful as they are.
We can't understand animals, but these brain scans is really allowing us to understand it to the extent that science will let us. And we have lots of questions coming in here as well. So I've got one from Kayla. Kayla asks, in the case of an animal with excuse me, I might pronounce this wrong, cerebellar hypoplasia, how would the shape of the brain be altered?
That is a great question. So again, the cerebellum is the, that's okay, is the smaller part of the brain. So I also have a horse brain here with me, which again just kind of shows you how small this brain is compared to how large a horse can be. But it just gives you a nice overview of these two cerebral hemispheres with all of the grooves, and then the cerebellum at the back part of the brain. So the condition that you brought up is a great one. It is called cerebellar hypoplasia, which means that the cerebellum is a lot smaller in size than it's supposed to be. So you can actually see that on the MRI if you measure the size that the normal cerebellum would be. It can be, you know, a third or half the size of what you would expect to see. That's something that we can see, especially in kittens that get certain infections, either when they're in gestation or shortly after birth, that the cerebellum doesn't grow as much as it's supposed to. So then that means as they live their life, they can have problems with coordination. Fortunately, it's not something that gets worse over time. So they look a little funny when they walk around. They can have some head bobbles, but it's not painful, and most of them learn to live with it just fine.
Very good question. And how do you pronounce it again? Cerebellar hypoplasia?
Cerebellar hypoplasia, which is a term that just means that the tissue is not as developed as it was supposed to be.
Very cool. And thank you for showing that brain. That's a real brain as well, hey?
It is, yeah.
The perks of being a vet. Robbie and Krista also ask, can dogs develop OCD?
Yeah, so we definitely can see similar behaviors in dogs, and we don't know fully why these things happen, but absolutely we can see dogs that develop very compulsive behaviors. But I would say more often than not, when dogs do develop behavioral problems like that, we would worry a little bit more that it could be from an actual neurological problem. So I see dogs that have things like brain tumors, or dogs can get meningitis, you know, all of the things that people can be affected by. Most of them we see in our dogs and our cats as well. And so we can see dogs develop really compulsive behaviors if they have something like a brain tumor. So if a dog develops those signs at, you know, an older age, it's something that we may want to investigate further to make sure it's not something that we can be treating.
So this question is for the pet owners as well, but what are the symptoms that we should look out for that you would encourage for us to visit a vet?
Yeah, so neurologic disease can be really difficult to recognize, especially because animals are, you know, made to hide things so that they don't seem susceptible. And so you have to be watching them really closely. But some of the things that would make us want to recommend an MRI of the brain on a dog or a cat especially would be, again, changes in behavior is a big thing. Also, if they start to develop seizures, that's one of the more common things that I treat on a day-to-day basis.
Oh, okay.
Or if they start to have difficulty seeing or processing visual stimuli, but their eyes are otherwise looking normal, then we think it's not a problem with the eyes, but a problem with the connection into the brain.
Gotcha. This reminds me of a case study that you worked on back in 2018, I believe, with an 11-year-old dog named Louie. So Louie was experiencing seizures, and his pet owners brought him into the vet. Can you walk us through what happened there and what did the MRI detect?
Yeah, so there are a lot of reasons dogs can have seizures, just like people. And one of the more common reasons is actually epilepsy, which is a benign seizure disorder. But that usually starts when animals are younger. So when we have someone like Louie that was a little bit older when we started to see these signs, we were definitely worried that there was an acquired problem in the brain. So first, we always try to make sure that systemically he's healthy, so he doesn't have any problem with his liver or his kidneys or any signs of infection. And then when we don't find anything there, that's when we're going to look in the brain. And so Louie actually had a brain tumor called a meningioma. And so it is the most common brain tumor that we see in dogs and cats. It's also the most common brain tumor found in people. So we can know a lot about this disease process by kind of sharing our knowledge across species and between, you know, human doctors and veterinarians to make sure that we can offer our patients, you know, the best possible treatment and give them the best long-term outcome.
This brings up a really interesting point because you just mentioned something that reminded me of a case study in humans. Have you heard of Henry Molaison? Molaison?
No, I have not.
It's a fascinating story, and I wonder if that story piqued something in neuroscience in animals. But essentially, he was a human that was experiencing epilepsy, and he underwent brain surgery, similar to what Louis the dog did. And the doctors removed a section of his brain to stop the
Okay.
epilepsy and seizures. However, I think they removed a little bit too much, and of his brain, and now he can't form any new memories. So he could only remember everything up until the surgery, but he can't form new memories. And that whole operation reminds me a lot of Louis because I think you removed the brain tumor from Louis' occipital lobe as well. Is that
Yes,
correct?
we did. Yeah. So I don't know if you wanted to show, we have a
Oh,
couple of pictures.
absolutely. Let me just pull that up here. This is really cool because Louis' MRI scan, first of all, his owners didn't really see anything abnormal other than his seizures. So he was alert, everything was fine, but then the seizures came. And this is what we found in the MRI. What can you share with us?
Yeah, so I think that what you just said is something really important to recognize is that even though animals have a disease that maybe has been going on for a little while, sometimes it doesn't really become obvious to us until it reaches a critical point.
Mhm.
So on these pictures, we can see there's two different types of scans here. So with MRI, we run a number of different scans to get different information about each tissue. And so the ones on the left are similar to the ones that I was showing of all of the normal brains. The ones on the right are after we've given an injection into the vein of contrast. And that really helps highlight things that are abnormal. So the really white structure that
Mhm.
you can see on the top image there, yeah, that's not supposed to be there. So again, we don't know exactly what it is based on the MRI, but fortunately, since Louis' owners were very willing to do everything for him, we were
Mhm.
actually able to do surgery to remove that and confirm that it was in fact a tumor.
And we do have an image of this as well. And for the folks at home, we do have a warning sign here. It may be something that you may find disturbing, but if it is, I would advise you to turn off or look away right now because we're going to show an open neurosurgery of Louis' brain. Here we go. So,
Yeah,
what can you
so
tell us here? Is that the tumor itself that's being removed?
So here we're still just at the level of the skull. So again, since we have, a good protection for good reason around the brain,
Yeah.
when we have an animal, we have to do quite a bit of digging in order to gain access to the area where the abnormality is. So Louis' surgery would have been in a very similar location to this change on this skull that I have here.
Yeah.
So what we don't see is that there's normally quite a large amount of muscle overlying the skull that we have to pull away, and then we have to make a window into the bone in order to gain access to the brain. So in the picture, that was just showing us use what we call a high-speed drill in order to make that little window. We take it away and then go ahead and remove the tumor. And we actually normally will put that piece of skull back to make sure that everything's well protected again.
So the brain tumor was removed and Louis was okay.
Yes, Louis went back to normal. He did very, very well, went home to his family, and all of his abnormalities or his deficits were resolved after treatment.
That is really, really good news and a huge testament to how amazing the MRI as a tool is and the work that you do. We have a question here from Sarah, and Sarah asks, can an MRI show if a dog is better suited to be a working dog or a civilian dog?
That's a really great question. So one of the things that is kind of frustrating about MRI, as great as it is it really only tells us about structure. What we really need to do next, and it is coming, and there's a lot of research in this area, is also looking at function. So you may start to come across what's called fMRI or functional MRI. And that's
Mhm.
where we can actually look to see not only the overall picture of the brain, but with certain activities or certain stimuli, we can look to see different parts of the brain actually more active than others to really get an understanding of how animals use their brain for different things.
So this is the future of MRIs.
Yes. absolutely.
That is so cool. I have one final question for you because we are at time, unfortunately. Thank you, everyone, for sending your questions. This is just a fun question to end us off, Kathryn. What is an animal? Is there an animal that you haven't worked with that you would love to work with?
There are many. It's such a good question to end with. Like I said at the beginning, I'm definitely a cat person. So, one thing I would really love to do is to do an MRI or a study on a larger cat, like maybe a panther or a tiger, just to see how they compare to the cats that I work with every day. Because I'm sure they're very similar, but again, hopefully bigger. But I know that there's still a lot more to learn about all different animal species. But that one in particular, I would love to spend some time with.
The comparison would be absolutely amazing. Kathryn, thank you so much for joining us here today. I had a lot of fun learning about animal brains. I'm sure there's lots more to discover as well, and I can't wait to see where the future of MRIs as a tool will take us. Thank you so much for joining us, everyone. I hope you enjoyed learning about animal brains. If you want to check out more, be sure to stay tuned at sparkscience.ca or check out Kathryn's bio on our website as well. Kathryn, thank you very much for joining us. Everyone at home, I hope you have a wonderful day.
Thank
Take
you.
care.